Welcome everyone to this knowledge exchange webinar on accelerating early childhood development outcomes through strengthened governance mechanisms in Africa and Asia Pacific regions. My name is Alicia Lutomia. I work as a programs officer at the Africa Early Childhood Network, and we are really excited that you could join us today. I would like to begin by outlining a few meeting protocols just to improve the efficiency in the conduct of this webinar's agenda. First, all participants are kindly requested to introduce themselves in the chat box, stating both your name, designation, and organization. And secondly, in case you have any questions during the presentation and panel sessions, kindly post your questions in the Q&A box at the bottom of the screen for the presenters and panelists to respond to. Comments are also welcome in both the chat and Q&A boxes. And lastly, we have French interpretation. You may click on the globe icon at the bottom of the screen to your right to access either the French or English interpretation during the meeting. That is all, ladies and gentlemen. And so to start us off, I would like to invite the co-moderator, Meenakshi Dogma, who is the Asia Pacific Regional Network for Early Childhood, ARNEC, national representative from India, and the coordinator for the ARNEC learning groups, to share with us the meeting agenda and expectations. Thank you very much. Over to you, Meenakshi.
Thank you so much, Alicia. First of all, on behalf of Asia Pacific Regional Network for Early Childhood, I welcome you all for participating in the first webinar of the series. So the agenda of our today's event is to first share the findings of the landscape analysis on governance and coordination mechanisms for early childhood development, a study conducted by Africa Early Childhood Network in the region, and also to showcase some best practices of multi-sectoral coordination mechanisms for early childhood development in the region. In the next session, there will be an expert panel discussion to share some country-specific good practices on multi-sectoral coordination mechanisms for ECD from both Asia and Africa region. To set the base of the event, I would like to invite Dr. George Ovino, Program Manager from Africa Early Childhood Network, to give his opening remarks. Dr. George, over to you.
Thank you very much, Meenakshi, for the opportunity you've accorded me to give the opening remarks for this knowledge event. Good morning, good afternoon, and good evening, colleagues. Welcome, and thank you for joining us during this important knowledge exchange event, where we explore ways of accelerating early childhood development outcomes through strengthened governance mechanisms in Africa and the Asia Pacific regions. This event is hosted by the Africa Early Childhood Network and the Asia Pacific Regional Network for early childhood, and it is the first of a two-part webinar series, and it has two main objectives. As has been mentioned by Meenakshi, the first objective is to share findings of a landscape analysis on governance and coordination mechanisms for ECD in Africa. And the second objective is to showcase best practices of ECD multi-sectoral coordination mechanisms in the two regions. Over the last decades, as you may be aware, there has been an increase in evidence from multiple disciplines that demonstrate that increased investments in early childhood development is one of the best ways of laying a strong foundation for the health, well-being, learning, and productivity of our young children. Longitudinal studies consistently show that investing in quality, comprehensive ECD services that encompass health, adequate nutrition, responsive caregiving, safety, and security, as well as opportunities for early learning, is critical to realizing positive human capital outcomes with the enormous long-term benefits for societies, for businesses, for communities, for families, and even for the children themselves when they grow into adulthood. It's also increasingly evident that strengthening multi-sectoral coordination and convergence across sectors of health, education, and social protection at different levels is essential in designing and implementing quality and comprehensive programs that address the holistic needs of children. This knowledge event, therefore, is timely as it provides an opportunity for sharing best practices of multi-sectoral coordination mechanisms for ECD in the Africa and Asia Pacific regions. The mission of the Africa Early Childhood Network is to serve as a platform for promoting collaboration in protecting children's rights through influencing ECD policies, programs, and practices. Our vision is for an Africa where all children are learning, are safe, healthy, happy, and achieving their full potential. This knowledge exchange event therefore reflects our programming, which is organized around 4 thematic areas of regional advocacy, regional and national networking, implementation research, as well as quality improvement. To this end, therefore, AfECN is privileged also to coordinate the Africa Union CISA ECD cluster, which supports the realization of the CISA 1625, which is a 10-year continental strategic plan that relates to the early years. Partners are invited to join any of the 4 working groups of the CISA ECD cluster and to participate in policy dialogues and share experiences and their expertise to advance ECD agenda on the African continent. For more information on how you can join and participate in these cluster activities through the working groups, our colleagues will be posting links in the chat box that you can follow to just see how you can be part of the cluster and also be part of the Africa Early Childhood Network. Thank you very much, and I wish you all an insightful and engaging knowledge exchange event. And at this moment, I would like to return the microphone back to Meenakshi to take us to the next level. Meenakshi.
Thank you so much, Dr. George, for providing the base and opening the event with your valuable words. With this, as we move towards our sessions, I would like to introduce Ms. Stella Nugayer as a moderator of our next 2 sessions. Stella is an early childhood development expert with 18 years of experience in designing and managing program quality for child-centered programs, policy advocacy, high-level strategic communications, and partnership management across 20 African countries in East and South Africa. Stella offers technical support to multi-sectoral technical working groups and is also a founder member of Baby Cares Consortium and ECD Network for Kenya. I would like now invite Stella to kindly moderate both the sessions. Over to you, Stella.
Thank you so much, Meenakshi, for the kind words and the warm welcome. Ladies and gentlemen, a very warm welcome to this knowledge exchange session. And we move swiftly to a presentation Moses Abiro is titled Landscape Analysis of Government Mechanisms for ECD in Africa he's going to detail to us the relevant study findings and recommendations. So Moses Ramane, host and advocacy ECD specialist, having had over 15 years of experience in policy advancement and programmatic reforms in early childhood across the African, from Kenyatta University, focusing on early childhood. And I'd like now to invite him. Moses, welcome, and you have about 7 minutes.
Thanks so much, Stella, for the wonderful intro. Colleagues, welcome to this knowledge exchange event. As Stella indicated, my name is Moses Abiero. I work at Africa Early Childhood Network as program manager, basically supporting regional advocacy work. So basically, this presentation will give some key highlights on the findings of landscape analysis that we did on governance mechanisms that support early childhood development service delivery on the African continent. So basically, the presentation will highlight methodology used, the progress, challenges, and some options that may be considered to strengthen multi-sectoral coordination in ECD service delivery. As we are all aware that children develop holistically, and therefore they require services from multiple disciplines located in multiple sectors. And therefore, we did some landscape analysis, basically a desk review, analysis and documentation of existing evidence, basically around legal, policy, and institutional frameworks, nature, type, and level of financing, monitoring and evaluation mechanisms, and level of policy implementation in terms of access and quality of services provided. So in terms of existing policies, we realized that close to 45 countries on the African continent have developed some form of ECD policies addressing needs of children during their earliest years. Out of these, 38 of the countries have some form of multi-sectoral approach to ECD, with the latest being Sierra Leone. We developed the National Policy on Integrated Early Childhood Development this year, 2021. This is a tremendous achievement, considering that only 2 countries, Mauritius and Namibia, were reported to have developed ECD policies by the turn of the century. Basically, this gives us some gist in terms of some of the countries with some form of multi-sectoral approach to ECD, with best practices drawn from Mauritius, Senegal, Seychelles, Ghana, Kenya, Zambia, Malawi, South Africa, Tunisia, among others. So in terms of institutional framework, we found out that most African governments have assigned ministries and agencies roles to coordinate delivery of ECD services. And the choice varies from country to country, and depending on a number of factors, including long-standing leadership and expertise in the area, and also centrality to supporting interministerial efforts. Basically, the landscape shows that ministries of education, planning, women, gender, community, children affairs, and sometimes offices of the president and prime ministers are involved in coordination of ECD service delivery. In terms of financing, we realized that ECD services across the countries are funded through mixture of public and private streams. We realized that donor and government spending on ECD continue to grow, though at slower pace, with majority of funding done by governments. On the flip side, discrepancies were realized with funding, most of the funding targeting health and nutritional components, less funding targeted pre-primary education. We also realized that most African countries spend less than 1% of their GDP to support ECD services. This gives us some examples of countries in terms of per capita spending on ECD, whereby in Eastern and Southern Africa, we realized that the estimated average per capita spending on ECD is around 138 USD, where Botswana and South Africa were reported to spend around 500 USD, and Burundi, Uganda, Mozambique, Eritrea, and Ethiopia reports indicated that their per capita spending on ECD was below 20 USD. In terms of spending on pre-primary, on average, we realized that most governments spend less than 10% of their total educational budget on pre-primary education. And therefore, in terms of realization of ECD outcomes, we realized that despite improvements in the formulation of ECD policies across the region, implementation remained weak, and therefore exposing many children to risk of not realizing their full developmental potential. Most countries remain in the red, with only Algeria, Egypt, Morocco, Gabon, and Ghana reported to have lower proportion of children at risk of poor development. So in terms of challenges, we realized that there are quite a number that could be looked at, including lack of costed implementation plan, weak institutional framework to support multi-sectoral coordination, poor financing in terms of lack of financial strategies to guide financial transfers, subsidies and pricing, and also weak quality assurance. In terms of options that could be considered to strengthen multi-sectoral coordination, need for more generation of evidence and cultivation of strong political will, establishment of strong institutional framework with clear definition and assignment of roles, strengthening stakeholder involvement at national and local levels, and strengthening capacity to monitor coverage and quality of services. At this juncture, I would like to welcome my colleague Anahita from the Commonwealth Secretariat to give us some highlights on the features of the ECD toolkit. Welcome, Anahita.
Thank you so much. Thank you so much, Moses, for your very informative presentation. Good morning and good afternoon, everyone. My name is Anahita Alexander Sefri, and I work for the Commonwealth Secretariat in London, UK. I will be giving a very brief overview of the Commonwealth Secretariat's Early Childhood Care and Education Toolkit, which has just been updated in light of the pandemic and also the pilot, which took place in Kenya and Ghana earlier this year. The aim of the Commonwealth ECC Toolkit is to provide a resource on how to best enable and support a multi-sectoral approach for increasing access to quality early learning and development. So briefly, I would like to take you through the 5 sections of the toolkit, which are on the screen now. The first section presents the rationale for multi-sectoral ECC provision, with the Ministry of Education as the lead agency. So here, key advocacy functions are outlined and strategies for a successful multi-sectoral approach are discussed. Section 2 outlines the value of conducting a situation analysis to gather information about gaps and strengths within a national ECC context. Resourcing and costing for policy initiatives are discussed here, together with planning for a professional workforce. The third section discusses governance mechanisms that are key to successful policy implementation, as well as cross-sectoral and cross-ministerial partnerships building sustainability and going to scale, as well as funding strategies. The section 4 outlines key structural and process variables that are amenable to policy intervention with the aim of expanding access while enhancing quality and equity of provision. Finally, section 5 identifies the need to ensure data monitoring and evaluation systems combine diverse sources of information and are compatible across sectors in order to advance the goal of a systemic multi-sectoral approach to ECCE. So this has been very short. It's a very short brief summary of the ECCE toolkit, which I hope was useful and interesting for everyone. Our updated toolkit has been finalized now, and we are just waiting for the final published product, which fingers crossed is going to be available in the new year. My colleague, Mr. Nasir Kazmi, who is the education advisor at the Commonwealth Secretariat, will be going through a more in-depth presentation, hopefully in our next general meeting, early next year, which I very much look forward to. So thank you very much for listening, and back to you, Moses.
Thank you so much, Anahita, for that wonderful presentation. I take the program back to Stella. Thank you so much, colleagues.
Thank you so much, Moses and Anahita. We have learned that despite formulation of ECD policies in Africa, many children still face suboptimal development. We have had an overview of the ECD Accelerator Toolkit from Anahita, which was very informative. Ladies and gentlemen, now we open up the floor for any questions, and for that I invite Alicia for a couple of questions if there are any.
Thank you, Stella. We don't have any questions at the moment, but I believe that as we proceed, we'll have a few questions coming on board.
Okay. Thank you very much, Alicia. To the participants, we are now transitioning to a panel discussion. And basically, we have a panel of experts. And ladies and gentlemen, before I introduce you to the participants, based on your experience, in about 30 seconds, we will be asking you to share with us, a major challenge facing multi-sectoral collaboration and coordination of ECD service delivery in your contexts. And with that, I'd like to introduce Mr. Cham Kalambikia, who is the Director of ECE at the Ministry of Education in the Republic of Zambia. He also chairs the AU ECED Cluster Policy and Advocacy Working Group. Mr. Cham has extensive knowledge and expertise in human development work. Before being director responsible for ECE, he served as Director of Governance in the Ministry of Justice. He holds a diploma in agricultural education, a bachelor in adult education, and a master's in human resource management. Next, I would also like to introduce Ms. Joyner Fungo, who is a Senior Program Officer with GPE Knowledge and Innovation Exchange KICS program at IDRC. IDRC is International Development Research Center. She has had over 10 years of experience working in various education and ECD initiatives in the development of the research sectors. She manages and provides technical leadership to several education and ECD projects in East, West, and Southern Africa. And our third panelist will be Professor Kishore. He holds a PhD in ECE, is a chairperson of Alliance for Early Childhood Development Nepal, and he is a member of the board of directors of the World Forum Foundation in the USA. He is an executive committee member of the International Network on Peace Building with Young Children in the United Kingdom. He was a steering committee member of ARNEC from 2008 to 2011. And for over 35 years, he has been conducting research, training, and innovative activities in ECE early childhood care and education in Nepal and beyond. So to our first panelist, who is Mr. Cham Kalimbika of Ministry of Education, Republic of Zambia. Please highlight to us a challenge that may be facing facing multi-sectoral collaboration in your context.
Thank you very much, Esther, for giving me this opportunity to discuss this issue. I would say that gaps in policy implementation, especially weak institutional framework characterized by inadequate resourcing of key institutions involved in coordinating ECD services. Further, you would find that in Zambia, there have been various policies to address ECD, including national population policy, national health policy, the national child health policy, national food and nutrition policy, national child policy, national education policy, and national early childhood education policy. We are now considering developing an integrated ECD policy to guide multi-sectoral coordination. Zambia has mapped the opportunities to integrate ECD services into existing service delivery platforms in a range of sectors, including health, education, child and social protection, youth, sport and child development, agriculture, as well as the environment. For example, currently, the Ministry of Education, in collaboration with other line ministries, UNICEF and other key stakeholders, is piloting INSACA model that strengthens community leadership and action on responsive caregiving, which include early learning, health, stimulation, and protection. The ministry is also encouraging school gardens and other means of income generating activities to support school feeding through a multi-sectoral approach with the Ministry of Health and Agriculture. Furthermore, the existence of multi-sectoral ECD committee coordinated by Ministry of Health, it brings together diverse group of stakeholders. It also brings together line ministries, communities, and stakeholders from key sectors and organizations. And this multi-sectoral committee, which is coordinated by Ministry of Health, is chaired by the permanent secretary from the Ministry of Health. I submit, Chair. Thank you very much.
Thank you very much, Mr. Cham, for giving us that overview of the challenges, but also some work under multi-sectoral collaboration. And it seems that in Africa, Zambia is doing a phenomenal job strengthening multi-sectoral collaboration across the country and across sectors. Please share some key highlights of these mechanisms or any other outcomes so far, and a best practice from Zambia's experience as we finalize your session. Thank you.
But I didn't get you, Sarah. The question is directed to me?
Yes, any other best practices that you can share from your experience in Zambia?
In terms of coordination?
Yes, in terms of coordination.
What we do is that in Zambia we have different ministries, which suffice to say the Ministry of Home Affairs, and Internal Security. We have Ministry of Sport. We have Ministry of Community Development, Ministry of Agriculture, and Ministry of Education, including the Ministry of Health. So what we do normally is that the chair remains the Ministry of Health. So what changes is the Secretariat, because we do it on a rotational basis. So I find this time around, it is the Ministry of Community Development and Social Services, which is the Secretariat, but the Ministry of Health remains the chair. So that is how we do it. But so we find that at national level, it is very strong. The weakness that we have is that at the district level, we find that the coordination is not as strong as it is at the national level. This is because sometimes it's affected by issues of resources, the finances to run the program. But it is doing very well because we have even programs, the INSACA, which I mentioned. The INSACA is where they come together. The UNICEF has helped us to build infrastructure where all these line ministries I've mentioned and the other communities come together to deliver services through INSACA. I submit.
Thank you so much, Mr. Kalimbika, for that best practice. So, ladies and gentlemen, we move over to Joyner Fungo of IDRC. Joy, you can start with a challenge around multi-sectoral collaboration and coordination in your context before we move into your specific question. Over to you, Joy.
Thank you, Stella, and thank you to African Early Childhood Network for inviting me to be part of this panel. My name is Joyner Fungo, and I work for International Development Research Center in the GPE KICS program, and I'm happy to be here. So in terms of a challenge, Stella, I think as a research institution, we acknowledge the role of evidence, particularly in helping us understand more about the needs of children. And also we acknowledge the role of multi-sectoral coordination, particularly in supporting children's holistic development. However, even as we do that, we also are seeing that there's inadequate research that has been carried out, particularly on challenges and also highlighting what actually works in terms of multi-sectoral coordination. And not just what works, but also how to implement the available recommendations and lessons, especially at regional and national levels. I think this is very important, especially in our context, African context. Within our context, we still have other sub-contexts. We have different, for example, contextual issues. We have different challenges that we need to address. For example, the challenge of rurality, urban informal settlements, children who are marginalized because of conflict or post-conflict contexts. So our role, of course, is to support research, but also to be very intentional in ensuring that we fund research that highlights challenges, but also solutions facing ECD multi-sectoral coordination in the African context. And related to these challenges, of course, we also see that there is lack of integrated ECD policies, as well as lack of appropriate institutional framework, which makes intersectoral collaboration and resource allocation extremely difficult. And also because of this, we have witnessed that there's tendency for siloed work among sectors. And so this makes even advocacy at national levels very difficult for policymakers. And also it's a challenge facilitating interministerial coordination. Even as we continue funding ECD programs, we have to be very intentional in strengthening knowledge mobilization, especially at national levels, because there are other challenges related to bureaucracy, related to resource allocation, and also lack of capacity in terms of facilitating cross-sectoral collaboration and multi-sectoral collaboration. I think another thing that we are seeing is that there are differences, especially in the target population by sector. And this is mainly, again, related to research because of inadequate knowledge in the public domain regarding the importance of holistic and integrated ECD. Like I mentioned earlier, issues of marginalization are key, especially in our context. And until we're very intentional in understanding the different levels of marginalization, it's also very different to tailor specific needs and services that meet the needs of this population. And then, of course, also, like I said, because of lack of evidence on what actually works, we are seeing inadequate technical skills among ECD workforce, and of course, not just skills, but also resources of various types, limited technical human resource capacity, which also leads to delays in meeting some targets. Particularly if we are working, let's say, a 3-year or 4-year or 5-year project, it becomes very difficult to meet those targets within the time frame. And then I think I also want to agree that there's insufficient financial resources. We also acknowledge what financial support does for any program to assume shape. So even as we talk about the importance of multi-sectoral coordination, we also have to acknowledge that ECD investments should be increased to expand service coverage, to improve services, and also ensure that these services are sustainable, not just for now, but also for future. And also that these services are high in quality, but also cost effective, especially for our context. And again, related to research, ensuring that we develop indicators that measure these investments as outputs, and also their outputs, also the inputs and outcomes to be included in the investments. I think I'll stop there, Stella, back to you.
Thank you so much. Those are quite a number of challenges that Africa is facing, especially given that you're a research institution, but also you support with financing, and you've noticed that there's limited technical capacity of a lot of the human resources. So to your specific question, IDRC strengthens policy innovation. Highlight one experience of best practice related to the work that you do. Please focus on improved governance of ECD services in Africa and how we can leverage research opportunities to strengthen the theme, given that we have so many challenges. I'm sure there's a possible solution to the problems. Yeah.
Thank you, Stella. It's actually very difficult to focus on just one lesson, but I'll try to do that. So again, as a research institution and also as GPE KICS, knowledge exchange is crucial and central to our work because we acknowledge the role of knowledge exchange, particularly for cross-country collaboration, for cross-regional learning and collaboration, just like what we're doing right now. I think this and other events are an example of what knowledge exchange can do in terms of learning about what happens in different contexts, and maybe also just picking up some of these lessons into our context. And so what we do is we want to promote South-to-South cooperation. We want to promote knowledge mobilization. We also want to see how we can scale up, we can generate lessons that will be helpful to scale up innovations, particularly related to multi-sectoral coordination within ECD. And of course, we do have other strategies, and it's good to highlight all these strategies within ECD. It's good to bring them to the front. It's good for stakeholders, ministries, to be aware of what works within their context, also in other contexts, and to see how this would help. So knowledge exchange is crucial. It helps us open our eyes to different approaches to ECD policy, to different opportunities and mechanisms for routine multi-sectoral coordination. But also knowledge exchange helps us to strengthen communication on specific priorities and also what is happening at national, regional, but also sub-national levels. And when we talk about knowledge exchange, it's not just about blanket sharing of information, but we want to focus on interactive sessions, for example, facilitating interactive sessions, facilitating dialogue-based approaches rather than the traditional didactic predetermined messages that may not make sense to specific contexts. And then also related to knowledge exchange, it's also important for us to continue being intentional in generating evidence, particularly focusing on the benefits and lessons of specific approaches related to specific approaches. And as we do this, we hope that we'll be contributing towards capacity development, capacity building for policy implementation, not just at national level, at subnational level, at community levels, and also improving the delivery of quality services, and of course, creating the demand for these services at a regional, global, but also national and subnational levels. Thank you, Stella.
Thank you so much, Joy, for that, for those extensive solutions to the problem. Thank you very much for your time as well. Next, we move to our academic elite, Professor Kishore, the chairperson of Alliance for Early Childhood Development, Nepal. So, Professor Kishore, several countries in the Asia-Pacific region, Nepal, have been making efforts to implement multi-sectoral convergence models to strengthen coordination of ECD. Please share Nepal's experience in terms of the role of Alliance for Early Childhood Development, and maybe a challenge that can fit into that context.
Well, thank you, Joy. It's Charm, isn't it?
Stella.
Yeah.
Yes.
Stella. Thank you very much for giving me this opportunity to share our experience in terms of having this multi-sectoral convergence in early childhood development. In fact, the organization that I'm involved is called Alliance for Early Childhood Development Nepal. It's formed basically to support different organizations to bring them together and to converge the different activities being conducted by different organizations for early childhood development. So it is like that. So the major motto of this organization is to partnering to promote a holistic approach to change the lives of young children in Nepal. So for last 5-6 years, our experience has been both challenging, very challenging, as well as encouraging. So the challenge, if you talk about so far, the development activities or development efforts that has been made in this country is more sector based. So there is a culture of working in isolation. So there's a big hurdle in our efforts to develop this multi-sectoral approach to early childhood development. But we are also happy because we are able to do, in spite of all these several challenges, we are able to make some important achievements in last couple of years. Among them is related to developing a national strategic paper, which focuses on multi-sectoral coordination and implementing early childhood development programs for the holistic development of a child. So as I said before, this organization itself is a kind of consortium of different organizations involved in organizing early childhood development programs in this country. So we have 22 organizational members and over 250 individual members. The individual members and organized, they come from different sectors, some from health, some from nutrition, from stimulation or education. So that way we are together. And this organization has been conducting several workshops and face-to-face discussion as well as webinars, even this difficult time due to this COVID crisis. So it has become a kind of platform for the people to share their ideas and opinions and learn from each other. So that's what is the best thing that we are able to do so far. And as I said that, the problem doesn't end there. Having this national strategy paper is not good enough. But the most important thing is that the program has to address the holistic need of the child, health, nutrition, protection. So all that has to come to the family, to the child. And in that case, we are able to include this nurturing care framework as a basic principle of developing this studies paper. And as I said that the country, we are, the federal system is a very new experience for this country that, from a kind of unitary government to we are going to the federal government. So we have federal government, we have provincial government, and we have local governments. Now, if you look at the policies and programs and the legal provisions, all the authorities has been delegated to the local government authorities. So now it's a need for us to support the local government so that the program will have this multi-sectoral coordination at the bottom level. That's the third tier of the lowest level of the elected government. So they holds the power, and they have the power to develop the plans, policies, and programs. So in that sense, the national strategy paper that we have developed has been a national, that's the federal government's document, which is owned by the government as well as all the other organizations, those who are responsible in implementing early childhood development programs in this country. Based on that, we have been supporting the provincial governments. So the provincial government has also, not all 7 provinces that we have, out of 7, more than 50% of them, 4 provinces have already developed a provincial level strategic paper plan. And similarly, we are trickling down to the local government, which is very important for us because they are the ones who are implementing, this early childhood development program. So in that case, now we are partnering with ARNEC, and we are also working very closely with other organizations to develop plan, and not only plan programs and also implementation of this multi-sector program at the local level in the near future. So our experience shows that there is a need for a kind of horizontal as well as vertical coordination. So we are opting for that, and we are working on that. Thank you. Stella.
Thank you so much, Professor Kishore, for telling us that despite the challenges of COVID and the culture of working in silos, there is hope, which is very encouraging, and the work that you're doing is phenomenal. Anything else you can add about ECD plans led by the National Planning Commission?
Well, that is very interesting. The other thing is that even before this, it took about 2 years for us to, convince the government. One of the interesting things that you'll find in Nepal is that the Constitution of Nepal, which was promulgated only 3 years back, 4 years back, there's been a bit 4 or 5 years. In April 2015, we had a new federal system, and then we had a new constitution. So during the drafting of that constitution, we lobbied. We organized several consultation and orientation programs to the parliamentarians. So I was able to talk to half of the parliamentarians about the importance of multi-sectoral approach in early childhood development. And that was useful in a way because of those efforts that we have made. The constitution includes this early childhood as a fundamental right of every child born in this country. So it is guaranteed. Early childhood services is guaranteed by the constitution. And the age coverage goes from conception to age, 8 years of age. So that was a big achievement that we have made. And because of that, now it has been a kind of rights of every child. And then the National Planning Commission took interest in developing the strategy paper, because until that plan is developed, one cannot ensure that every child will have the opportunity to early childhood development. So then, we took more than a year. We are supporting this National Planning Commission. Again, as I said that, this alliance has formed another consortium which included, United agencies, UN agencies, INGOs, NGOs, and private sector. So then we provided some technical support to the National Planning Commission, and they followed the nurturing care framework, as well as they are more focused now onto the multi-sectoral approach in developing the children. So that was a big achievement that we have made. But if you look at the the past, until we have this included in the constitution, then it might not be possible for us to develop that. But because of that, we were able to develop this strategic paper, and which has focused on multi-sector development. So that's, we are happy in a way. Thank you.
Thank you so much, Professor. I think it's exciting, the work that you're doing in Nepal, developing the national strategic paper on multi-sectoral coordination would be something that Kenya can learn for. I support Kenya at the Ministry of Health to do similar work, and clearly there's much we can learn from that. It's very exciting. Okay, and ladies and gentlemen, we want now to engage panelists through priority questions raised in the chat box. And for that, I invite Meenakshi to support us briefly. Meenakshi, over to you.
Yeah, thank you. Thanks so much, Stella. So we have two questions with us. So one question I would like to read for Joy Fungo. It's from Coyote, and he would like to ask that can't relevant universities, departments assist both in collecting evidence and disseminating them among institutions and agencies across sectors? This may be a challenge, challenge our traditional views of universities, but they remain a huge resource waiting to be tapped. So over to you, Ms. Joy, for responding to this question. Yeah.
Thank you, Meenakshi. Indeed, we do acknowledge the role of universities, particularly in knowledge generation. And I just want to say that universities are huge IDRC partners. We work very closely with a number of universities in Africa. Even within our early childhood education programs, we are funding quite a number of universities in East and Southern Africa. And so I agree that they do play a huge role in terms of facilitating evidence generation and also offering solutions for evidence use. So yes, they are a huge resource. We build on what the gaps that they have identified, even and to help us know what to fund or know what to focus on. And so we do work very closely with universities, and we acknowledge the role that universities play. I hope that answers the question.
Thank you so much, Joy, for responding to the questions. Next question, for the next question, I would like to request Dr. George to please unmute yourself and share your question with Kishore. I hope you can hear me, Dr. George. You raised your question in the chat box, so I would like to request you to please ask your question directly to Kishore.
Thank you very much, Meenakshi. If you mean myself, I was just trying to share some information on Nepal, that they became a federal government with these other levels when they did elections 2017. So I was just sharing a link with the participants. Thank you. Thank you, and over to you, Meenakshi.
Are you just asking for the link?
Yeah, so thank you so much, Dr. George. Maybe Kishore, you can share the link in the chat box, and we can access more information about the data. Okay, so I have another question to all our speakers and in the Q&A chat box. So I would like to read that question. So the question is based on your experiences. So what do you think is the best strategy for a successful intersectoral collaboration and shifting the lead to a single ministry without creating rivalries between the different key ministries of early childhood development, such as health, nutrition, education, and social protection? Over to you, all the panelist member would like to respond to. Please respond to this question. Yeah.
Can I take up this, Meenakshi?
Sure. Yes.
Well, the first thing is that, you know, the ministries, we have different ministries because there are different, you know, their jurisdiction is different. For example, Minister of Health is the health, you know, they look after the health. There is no question about that, you know. We cannot ask the Minister of Health to do other activities. So they will be working in the field of, in the field of health. So that is their, a kind of, you know, jurisdiction, you know, a kind of their major responsibility. Similarly, other ministries, they have their own, you know, responsibilities. But a child, you know, a child of say 3 or 4 or 5 years old, you know, they need all other, you know, services. It's not only health. Health is not good enough for them to cover the other, you know, their developmental needs. So in that sense, you know, we can learn from it. Even Meenakshi, I very much appreciate about the ICDS program where you have formed this, you know, apex body at the Ministry of Human Resources. So similarly in Nepal, what we have been doing is we have formed a council where 6 different ministries, you know, from health, nutrition, education, and then, you know, this even including the finance. So women and children, so they have come together, and all the secretaries are the members of that council. So that is a way of working together. Otherwise, you know, earlier what happened was in Nepal, for example, you know, before the studies paper, mostly it was sectoral based, you know, only the health ministry work on the health and they don't care about anything. Now we are working about, you know, coming together, putting all these, you know, ministries coming together. And it's not only the ministry again, even the UN agencies and other INGOs and NGOs, those who are working in different sector, you know, health, nutrition, protection, you know, and early childhood. So they are coming together, and that's what is required for you know, ensuring the multi-sectoral coordination for holistic development of the child. And we also develop, you know, last time I was working with the UNICEF, and one of the studies that we conducted, there were a lot of pleading, you know, there are a lot of people were talking about having a separate ministry of early childhood development. So that could be one idea, but still, you know, that will have to have many other programs coming together, which is, you know, in terms of having a separate ministry. Then we started forming this council, National Council for Early Childhood Development. That's a very interesting thing that we have been doing. But still, as I said, that, you know, we are in the process. You know, we still need to develop the, you know, provincial level plan and then the local level plan. That's what we are working on. Thank you.
Thank you so much, Kishore. Any panelist would like to share his the comment?
Yes.
Sure, Moses. Yeah.
Yeah, thanks. I think that's a wonderful question, and I agree with Professor Kishore that basically, in terms of institutional framework that is adopted, basically what is needed is a clear definition of roles. And basically then there is also need for joint planning, monitoring and evaluation. And in all this, then resourcing and capacity become key. So basically in countries that have made good progress in terms of strengthening multi-sectoral coordination, in the ECD policy, the integrated one, the roles are clearly defined, and an institutional framework is developed that is well-resourced, that also links very well with the subnational and local structures. especially building strong grassroots collaboration and grassroots coordination and collaboration in service delivery. So basically, it's a system approach that brings all stakeholders together at the national, subnational, and local level. But capacity and resourcing are very key. Thanks.
Thank you so much, Moses, for sharing, for responding to this question. We have another question for Ms. Joy. So the question is about what do you think could be the best strategies to childcare among urban informal dwellers who are the mostly the largest uptakers of daycare services. So there are currently gaps with respect to the regulations, poverty levels, and quality. Yeah. So over to you, Ms. Joy.
Thank you, Meenakshi. I think from what we've seen and from research perspective, context matters. Urban informal settlements in one country in terms of approach to what works could be different in another country. For example, what we are seeing is that in some countries, a completely integrated multi-sectoral approach to service delivery is the most effective. While in other countries, the creation of clear and well-functioning mechanisms, both at community levels, at subnational levels, at national levels, may work. So I may not have a one-size-fits-all solution because we are funding quite diverse programs and innovations. But what we have learned is that understanding the context, understanding what works in respective contexts, particularly related to service delivery, is very important, and also offers an opportunity to identify and know what kind of infrastructure to provide, and also how to promote quality, how to promote reliable, equitable and inclusive ECD services to children and their families. And so another thing is related to children from informal settlements. I think it's also very important to be very intentional in integrating issues of equity and inclusion. We know that most of these children might not have access to ECD centers, might not have access to, for example, daycares or organized form of learning. And so we need to understand also power dynamics at community level, in terms of service providers, in terms of capacity of communities and families to support. And so again, like I said, we are focusing more on knowledge generation, knowledge sharing, but also at a higher level, understanding what works in what context, and also what kind of approaches to tailor in such contexts. Thank you. Over to you, Meenakshi.
Thank you so much. Thank you so much, Joy, for sharing, for responding to the question. We have another question. I would like to quickly ask all our panelists this question. So the question is about, can you speak a little more about what kinds of financing strategies you have found working best in facilitating collaboration across sectors for ECD? Yeah. So any one of our panel member would like to respond to this question?
Hello, Meenakshi, I can.
Sure, thank you.
Yeah, thanks so much. I think basically responding to the issue of resourcing or financing, we believe that ECD from the landscape analysis that we did benefits from quite a number of streams. Basically both private and public, including donor financing. So basically the best way to go around this is to have a financing strategy that looks at allocative decisions, and also in terms of targeting, such that we don't maybe target more resources for a particular component, but leaving the other. So basically then we come back to joint planning, and then looking at costing from that perspective to ensure that there is equity across all nurturing care components. So basically, also, we realize that bringing in a public-private partnership into this will also help. And an example is the SIP approach that was kind of done in South Africa. That is the social impact bond that looks at financing by bringing in both private and public sector into play. So that would be great. Thanks.
Thank you so much, Moses. Yeah, sure.
Can I add, Moses?
Yes, Cham, please.
Just to add on what Moses has said, in a Zambian context, this multi-sectoral approach, since they're composed of different ministries, and our system is that as a ministry, you have your own budget. Now, these development partners, what they have done is we are working with UNICEF Child Fund. For them, they provided, especially in terms of the infrastructure, where they built what is known as the Isaka model. So in this model, it means that different ministries, line ministries, they also contribute in terms of funds to the running of the center. So we know that it is not for now, it is not the best model, but it has worked very well, and we are through continuing polishing it. So what we are talking about in terms of financing is that development partners or cooperating partners, they're also involved in contribution in terms of finances, as well as line ministries. That is what is prevailing in Zambia. Thank you very much.
Thank you so much, Cham. Moses, we have one more question for you in the chat box. So I would like to share that question with you. So in the countries that have a well-integrated ECD multi-sectoral presence, do they also have laws that support such an approach and enshrined rights of children related to the services rendered by each entity? Is this something other countries that do not have such a strong multi-sectoral approach would they need to consider? Yeah, so over to you, Moses.
Yeah, thanks so much, Meenakshi. And I think that the question is spot on in terms of how to ensure that reforms that are geared towards strengthening multi-sectoral coordination realize the targeted outcomes. So basically, then what would happen is that in terms of strengthening the system, we consider across legal, policy, institutional, and programmatic reforms. So bringing in the concept of legislation in terms of also raising the political will will be great, because basically legislation will give the power even for resource allocation at that level, especially where we have both national and devolved systems. You realize that countries that have national legislative bodies kind of legislating issues of ECD would help in terms of increasing political will and also resourcing for ECD service delivery. At the local level, we also have countries with devolved functions with the local legislative bodies. So if these can also be realized at that local level, where policies that are developed at the national level are contextualized through legislation at the local level, that will give some strength in terms of implementation, because basically resource allocation goes together with the legislation. So allocative powers basically are given to the legislature in terms of targeting. So I think that will be great, and lessons from such best practices are there across the African continent. Thanks.
Thank you so much, Moses. So as we have covered most of the question, now I would like to hand it over back to Stella for wrapping up the session and giving her summary points. Over to you, Stella.
Thank you so much, Meenakshi and the team for the phenomenal job. I think we've had a lot, and the participants must be happy because we've been able to answer all the questions, which is phenomenal for a webinar like this across 2 continents. So ladies and gentlemen, I'd like to share highlights from the session. And from Zambia, we have learned that, there's multi-sectoral work happening in a big way in Zambia, mostly at national level. It's strongest there as it is better funded for the national level. So examples are Ministry of Agriculture, Ministry of Health, collaborating on school feeding, nutrition, and also social protection actors are included. We've had many best practices in Zambia. And one thing I liked about is that the overall host remains the Ministry of Health, but there is a rotational chair for that particular coordination in Zambia. From IDRC, our donor community, we had some challenges. As a research institution, the fact that the role of evidence building is quite important. How to implement nationally has been a challenge, and also regionally. There are contextual challenges, for example, context of informal settlements, the lack of ECD policies, which makes financing difficult. There's siloed approach, which seems to be happening in Africa, and also I'll mention later on in Asia Pacific regions. And also there's bureaucracy in the supporting multi-sectoral collaboration. There's a lack of evidence, which makes the capacity of ECD human resources to be quite limited. And then there's insufficient finance resources. So I think IDRC called for investments to be done to support financing for multi-sectoral coordination. There are some best practices highlighted that, a forum like this one, where we come together across continents to share knowledge, is a critical example of how we can share. And then there's knowledge mobilization is essential. Scaling up of innovations on ECD coordination is critical. Contextual knowledge, or rather understanding the context of a country, a region, is quite critical. So for example, working with community health workers or other resource people is critical. And then to be intentional on generating knowledge, and then in line with that, capacity building on policy development processes and improving service delivery. So that's from IDRC, the donor community. Then lastly, from the academic elite, we had challenges, but we also end on a positive note from Nepal, that despite the challenges, Nepal has been able to navigate. And some of the challenges were that the culture of working in silos or in isolation is quite rampant. And then of course, which all of us are facing the COVID crisis, and it's been difficult for them to convene. And then Professor Kishore shared Nepal's experience, where they have developed a national strategic paper on multi-sectoral coordination. This for us in Africa, we can learn from and replicate. So ladies and gentlemen of the panel and those who shared the presentations, would like to really Thank you for the hard work and your expertise. It's invaluable. And then we would now like to transition to Meenakshi for the next session. Thank you very much, and back to you, Meenakshi.
Thank you so much, Stella, and all our panel experts for sharing their valuable experiences with us. With this, before I hand it over to Ms. Evelyn Santiago, Executive Director of Asia Pacific Regional Network for Early Childhood, for her closing remarks, I would like to remind all of you to please do not forget to fill the evaluation form. We are going to share the link in the chat box. We request you to please share your feedback with us so that we can plan our future events accordingly. So with this, now I request Evelyn to please give her closing remarks. Over to you, Evelyn.
Thank you, Meenakshi, for the introduction. It has been a very good discussion and a very interesting conversation amongst the two regions, and of course, a very active set of participants. So on behalf of the Asia Pacific Regional Network for Early Childhood, or ARNEC, and the Africa ECD Network, I'd like to thank everyone who joined us in today's learning session, which really provided us with a lot of insights on how strong governance and coordination mechanisms can support better ECD outcomes. Of course, we've also heard a lot of challenges. Both the Africa ECD Network and ARNEC are advocating for multi-sectoral and integrated approach to early childhood development. We all know that young children need to develop holistically, and this requires a lot of vertical and horizontal coordination. Vertical, of course, in terms of coordinating from the local to the subnational to the national levels within the context of a country. And then horizontal, of course, across the different ministries and sectors. And we've heard a lot of those challenges, of course, not just in Africa, but in Asia as well. So while it is really great to see from the presentation earlier made by Moses that access to ECD services continue to improve, and that most countries have really increased their efforts in terms of developing ECD policies and plans, and most are supported by good governance coordination structure. But as pointed out, we need to see that these developments are translated to improved ECD outcomes. At the end of the day, what we want to see is that our young children are provided with nurturing care, which are essential to their overall well-being and development. This we need to see in measurable terms. The mapping undertaken by the Africa Network provides a good baseline for designing an evidence-based advocacy for strengthening governance, planning, coordination, and financing for ECD. The same mapping is being done here in our region, in the Asia Pacific region. So we're also undertaking a mapping that would look at these different governance and coordination mechanisms for ECD. But even before this mapping, we have been engaging the countries in the region through a community of practice that collectively discuss and reflects on the roles of the national ECD networks and other multi-sectoral coordination structures in providing effective mechanisms for quality ECD. And so in the process of these reflections and discussions, we've been seeing different models of these coordination mechanisms. One model you have already heard from Professor Kishore, the model of Nepal. Some are government-led, such as the ECCD Council in the Philippines and the National Committee for ECCD in Cambodia. Both are under the Ministry of Education. Other networks or coordination mechanisms are led by NGOs and civil society organizations, such as the Holistic and Integrated ECD Coalition in Indonesia. It's led by NGOs, but works very well with the government. And that is also the model of Nepal. Some national coordination mechanisms have strong sub-national or local level chapters, such as Bangladesh and the one that is being developed now, being formed in Bhutan. I think in the discussions earlier, I've heard that a critical gap is really in terms of district level coordination. So there are different models, and each has its share of good practices and challenges. But despite these differences, there are common features which we all could learn from. Similar to what have been discussed in this webinar, key areas include the need to have a multi-sectoral ECD policy in place, the importance of having a plan or a strategic plan that is based on the policy, having a structure with multi-sectoral representation, importance of having a lead agency, and a strong relationship between government and civil society. And most importantly, I think, the focus in terms of the most marginalized groups of young children, which include, for example, young children with disability. Similarly, issues on financing and monitoring are very clear, together with the need to strengthen evidence-based research and evaluation, again, for evidence-based advocacy and programming. In this regard, we are really excited to continue the reflection and learning exchange with the Africa ECD network, as I think we really need to harvest all the good practices as well as the challenges in advocating for integrated and multi-sectoral approach to ECD and the role that governance needs to play to make this happen. So please stay tuned for the next learning event, which ARNEC will be organizing together with the Africa Regional Network early next year. The next event will be focused on the results of the mapping exercise and analysis in the Asia Pacific region, and will also feature some of the experiences, and other practices in the Africa region, building on the presentation today. Again, on behalf of ARNEC and the Africa ECD Network, thank you so much for joining, and may you all stay safe and healthy as we are about to end a very challenging year. We hope to welcome a new one, which I hope will be a better year for all of us and for all the young children and their families, in the regions and beyond. So thank you so much once again. Thank you so much.
Thank you so much, Evelyn, for giving your closing remarks. So we would like to thank all of you, all our panelists, all our experts, and our participants for their active participation throughout the session. So thank you, everyone. And please do not forget to fill the evaluation form. We have shared the link in the chat box, so kindly use that link for filling and sharing your feedback with us. Thank you, everyone. See you soon. Yeah.
Thank you all. See you.
Thank you all and bye. See you next time.
Thank you. Thank you. Bye.
Thank you, everyone.
Thank you all.
Have a good day. Bye.
Thank you and bye-bye.
Bye, everyone. Bye, everyone.
Bye, everyone. Thank you.